Welcome everybody to the private clinic group this evening. This is a conversation I am so delighted to be having this evening with an attended group of such brilliant experts. Because in 25 years as a health and beauty journalist, I don't think I've ever heard weight loss talked about in this way, talked about as a journey that has a beginning, a middle, and an end that can be really supported by the lovely experts that we have here. So I shall be your guide, if you will, today. Think of me as an air hostess. I will try to make your journey as calm, as smooth, and as delightful, and as informative as possible. And stow your tray tables because we are ready for takeoff. One of the things that I think we sometimes don't think about when we're talking about weight loss is that you can go from having a weight issue to having a skin issue. And when we were discussing this a while ago, I thought that's what really stuck out to me, is that it's always been about scale weight. And with the rise of GLP-1s, it's just been about going from one size or one shape, one scale weight to something. And then that's it. That's the full stop. And we don't really talk around or explore it any further. So our first stop on our destination is with Layla. However, before we get into that, I do think I would love if you would mind introducing yourself to our attended guests. We have, of course, Layla, who is our nutritional expert. Would you mind just giving us a little bit of an introduction into your expertise in this space and how you are supporting this journey?
Yeah, sure. Hi, my name is Layla Gordon and I'm a registered nutritional therapist. And I really support people with weight loss, metabolic health, type 2 diabetes, and longevity. So obviously, the GLP-1 drug movement has been a massive topic and one that I am supporting people with from a multidisciplinary aspect, which is why it's so fantastic to be here tonight.
Hi everyone, my name's Dr. Vix Manning. I'm one of the aesthetic doctors here at the private clinic. I actually came up from Bournemouth this afternoon in the train strike, which was fun. My specialty is obviously aesthetics. I'm a GP by background, but I'm really interested in I run a weight loss clinic, but how the 360 approach to weight loss comes into play to actually basically make people succeed and actually win at this game. But actually making people metabolically healthy, but also along the journey, actually making sure they feel good, as you quite rightly said, good in their skin. So that's what we want to talk about today.
Thank you very much. Welcome. Thanks for being here. My name is Michael Mouzakis. I'm a consultant plastic surgeon with a special interest in the body contouring and vaser liposuction. I've been with the private clinic for the last 12 years, and my special interest is to help people to get the shape of the body they want, and also to treat a newcomer, which is the lipedema, which is a disease that affects many women in the UK. And so with these amazing colleagues, I think we can treat lipedema and any demand in a 360 approach. So thanks for being here.
And last but not least,
Thanks. Hi everyone, my name is Professor Sandeep Doctor. I'm a consultant plastic surgeon here at the private clinic, and my interest is body contouring after weight loss, whether it be with GLP-1, whether it be naturally, or whether people have lost weight via surgical means. And it is exactly what everyone said, a multidisciplinary approach, a journey for these patients, because they lose that weight initially and then they feel, well, what now? I should have felt amazing, but something is amiss in the fact that I've got this excess skin, or I'm not contoured to my underlying frame. And so I help patients achieve that.
and I probably should have led with who I am. My name's Imogen Wardner. I just love my panel so much. I was desperate to get to that. My name's Imogen Wardner. I have been a health and beauty journalist for 25 years. And you may be more familiar with my stage name / my name was too long for Instagram. I'm Emma Guns. So if you look out of your left window, you will see the beautiful rolling hills of nutrition and lifestyle changes. So Layla, how has the GLP-1 conversation changed your real life work now that this is an option that just wasn't available to people for such a long time?
Yeah, it's interesting. I mean, obviously it's a massive topic and it's one that I've been keeping a very close eye on. and one that at the start, I think a lot of nutritionists were very worried, very anti it, very scared about it. And I just like to sort of listen to my clients, listen to patients, and really feed off them and work out with them where this is going, where it's heading, where they need the support. And really, they're driving the movement. They're the ones that are obviously picking up the medication. And it's been so interesting to see how this has been playing out in my clinic. So as we said just before, I think I'm a nutritionist, so I don't prescribe it. So I don't know who is going off and not seeing me doing the drug. That's not part of what I'm involved in. But certainly people are coming to me and they're saying things like, can I get some advice from you? I'm thinking about taking it, or I am taking it, or I've been taking it. Now what should I do? And I've been lucky because I have a very busy practice and a really great community of people that I help. And a lot of them have been doing it in the right way. So it's been really great to support some people in terms of things like getting blood work done before, supporting with their nutrition, their diet, tracking their blood markers, and supporting them through that whole journey. So I've been really privileged to be able to do that with some people already.
Layla, you said something there that I think is really important, and probably everyone in the room caught it, is people who are doing it the right way. Because obviously we know that this is kind of spread like wildfire. A lot of people might be taking it. But what I think is interesting here is this idea that you can prepare for weight loss, which again isn't really something that I've heard before. You just sort of like, my preparation for weight loss when I've tried, I don't know anyone else in the room, has been to kind of gird my loins on a Sunday, do a big shop with only healthy food, and hope that I wake up on Monday with willpower. That's how. But I mean, we're talking about a completely different strategy here when it comes to preparation, aren't we?
Yeah, exactly. And, unfortunately, I think when a lot of people come to see these, us, the four of us here, they're at breaking point. Wow. That's what happens. You're at breaking point and you want an answer, you want it fixed quickly. And so you go straight in with something. And actually, unfortunately, with the GLP-1 medication, it should be something that is prepped up, right? So and I think now we're realizing they've got to do some prep. You've got to be really hot on your diet during and after.
Did anyone in the room know that about the prep? Just a murmur would do. Yeah.
So if, the private clinic are doing such a great job of really being at the forefront of realizing how can we support people holistically, multidisciplinary approach. And that would be something like, for example, like I said, doing some blood work, maybe even doing a digestive check on the internal microbiome, seeing are there any nutritional deficiencies? Because if there are already nutritional deficiencies in things like omega-3, magnesium, B vitamins, zinc, vitamin C, this is all going to impact how well you get on with the medication and how well your body responds to weight loss and how well your skin recovers. Because at the end of the journey, you don't just want to be losing weight, you want to be looking sculpted and healthy as well. And if you're not putting the right nutrients in during, that's potentially not going to happen and you're going to be left with, a situation.
Yeah. If you guys are 4 stops on this weight loss journey, if you're not taking care of it at the preparation point with you, are you just fast tracking yourself onto Sandy Median table?
Actually, this is the right order. So 1, 2, 3, 4 goes 5.
Possibly.
Right.
I've seen it. I've seen dramatic weight loss, and I've seen it around the face. So I've seen aging, faces looking 10 years older, unfortunately. Now, one of the main issues is that up to 40% of the weight loss is muscle mass. So you're losing muscle mass. And also the research says that you can still eat junk food and lose weight on the GLP-1 drug. It doesn't matter what you eat, unfortunately. So you've got to look at what food it was that got you into that situation in the first place. That's a key part that maybe I think has been overlooked. And helping people from a psychological point of view to change the cravings, address the food noise, and move away from the food that got them into that situation so that the body is as healthy as it can be.
And then once you've reached that goal weight or the ideal weight that you want to get a client to, what's the maintenance phase? How do we avoid regain?
That's a great question. So again, I've had that recently, even this week. So people saying, right, I've lost the weight. It's worked from various, and specialists have helped them to lose that weight. And then they'll say, but what now? And that's the question that I think now with this whole GLP-1 journey is the question we're asking is people are losing the weight, but what now?
Yes.
We don't want them to be piling the weight back on, which we're seeing is happening, or, you know, going back to the old ways with their diet. So that's a really key moment to capture people and support them because it is a psychological journey. So the cravings will start to come back. So when you start the medication, you stop craving sugar, alcohol, for example. When you come off it, you have got to be careful. And like we said, we all have to keep an eye on our diet. We all have to keep an eye on what we're eating. You know, I had someone say to me yesterday, he's lost a huge amount of weight. He's lost 10 stone, various things that we did to help him lose that. But he felt like he'd slipped up because he put a bit of weight back on. I said, no, you haven't slipped up. We all have to be looking after our nutrition. I do, you do, we all do.
Yeah.
At any stage of life, at all stages of life, but particularly after being on the GLP-1, you know, we need to be looking at protein, collagen, nutrients, hydration, fiber intake. You know, it's really crucial to make sure that we're nourishing our bodies.
And I think someone can hear that and think, oh God, that's just too much to think about. It's so much easier if I'm just reducing my calories and moving a bit more. I don't want to think about all of that, but that's where this support system comes in, isn't it?
Yeah.
Because actually our next stop is how to lose weight and lose weight well with Dr. Vix Manning. So how do you really kind of support that work that is done with nutrition with what you are doing as well?
I think it's a great question. So obviously the whole weight loss conversation is huge at the moment. You've all seen it in the press. You've probably all been writing about it, about kind of the GLP-1s being this lifestyle drug. And as soon as you stop it, you're going to regain weight. This is really important because in my mind, what we're trying to do is we're trying to give patients the bandwidth of a little bit of time while they haven't got that food noise going on to actually make these lifestyle changes because it is a lifestyle drug. So like a blood pressure drug, if you don't make any other changes, as soon as you stop it, your blood pressure is going to go up. We have to think of this as the same. So it's going to stop the food chatter, okay? While that's happening, this is where this multidisciplinary approach has to take kind of form, I guess. So yeah, with everything about nutrition, we need to make sure they're doing all the right things. But before we even go down the route of actually prescribing, you know, what is their lifestyle? What are they doing? You know, are they going to the gym? Are they having takeaways every night? You know, are they on the beers? You know, all these things are really important questions because if they're doing all these things, we're putting a plaster on a big gaping wound. So we need to be addressing that. And now in clinic, we've actually brought in it's called MAP Health. So we're actually looking at patients' data because you mentioned blood work. This is so important. So we're actually looking at people's epigenetics now of actually looking what's their genetic makeup that makes you who you are. So interestingly, I'll share my story because I did want Ozempic 3 years ago. I lost 3 stone. Happy days, tick. But I still wasn't metabolically healthy. So I did Zoe. You probably all heard of Zoe. I did that a couple of years ago and found out I was actually pre-diabetic. So, you know, the flags were warning me a little bit. And then in December, I actually looked at my MAP Health. So I looked at my epigenetics. I looked at my glucose monitoring for 2 weeks. And I also did my blood work. Really interesting. So I was actually on the 91st percentile of being insulin resistant, which is obviously a precursor for being diabetic. Also 91st percentile of being obese. Again, another risk factor. And also I found some other things out as well. But it actually, that's why. And also with my glucose monitor, which I wore for 2 weeks, every time I ate something, I wrote it down. The guys thought it was hysterical. So if I had a KFC once just to see what happened, my glucose spiked hugely. And I had a beer once, but I put the more data you put in, the more you get out. So I know what foods spike my blood sugar and what actually gives me a calmer ride. So I now can make those changes. I know what I'm deficient in. I know what sequence I need to eat and when I need to exercise. So I have this information. So I have not been on a GLP-1 now for 8 months. I haven't put on any weight and my glucose has completely been reset. So that was from the data that I now have. And I think it's so important for patients when we're guiding them into something that this is just a window of opportunity that we have to make these changes. That was a long-winded answer to your question.
No, I loved it. There's so much to unpick there because actually what you were saying about being in the 91st percentile with the obesity gene and pre-IVs.
Please don't print that.
is the fact that I think a lot of people will, a lot of readers, a lot of listeners, a lot of followers will think it is harder for me to lose weight. And then they look at the messaging online and it might know, eat less, move more. But you are, I don't, check my vocabulary here.
We are our biology.
But also there are people who might feel as though they are at a disadvantage and that disadvantage isn't imagined.
No. And I think it's really important, especially women, you know, when they get to the perimenopause, menopause, it's even harder. And we're all running, you know, really high stress jobs. The stress doesn't help because our cortisol spikes. We're all on our emails before we get in bed. I don't know how many of you do it, but I still do it. And I was like, no, you mustn't do that because that spikes our cortisol and we're supposed to be going down into the rest and reset. All these things affect, you know, how it works. Because in the morning, if we've had a crap night's sleep, when, you know, we don't function with glucose very well. You know, I watched, you know, on nights that I slept really well to those that I didn't, of what happened to my glucose spikes the next day. All these things we need to be encompassing in those consultations and actually giving our patients education so they can make those changes.
And I suppose one of the big education pieces is trying to explain to people, yes, GLP-1s are available. Yes, they may be appropriate, but they're not a magic bullet or a magic needle in this instance.
No. And I think, you know, we have to be really careful about that. You know, yes, they're getting bad press, but they also have so many benefits that we haven't touched on, you know, risk of cardiovascular disease reduction, risk of Alzheimer's reduction, calms down inflammatory markers, fantastic. It's improving your insulin resistance. It's improving your fat metabolism. All these things are fantastic. But it is a prescription drug for a reason, and we have to take that in mind. And there's people putting. I was having a chat with Alex recently. He heard a story that people were putting baked beans in their pockets to actually make them heavier. So when they could go online to get their their prescription, they could get it. And I was like, no. But people are actually doing that, and you know they're getting away with. You know they're going on these medications thinking they are this. They want to be a size 8. You mentioned it earlier. You know it's really scary. So all our patients that come through this journey, we are seeing them face to face eyes, you know, going through all that and making sure they're being handheld all the way.
Now, you look at your patients' face-to-face eyes. I keep hearing from people that there are some telltale signs about when someone has perhaps used a GLP-1 and has gone a little bit too far. So again, in your field of expertise, what are the aesthetic treatments that can go alongside perhaps a prescription?
I think this is really important. So basically, as we've all said, when we lose weight, for every 10 kilograms of weight you lose, you're actually losing a vast amount of facial volume mass. So we need to be looking at this. And if you lose weight quickly, you're basically, it's like an elastic band. If you ping it too far, it's going to snap. The same happens with our skin. So slow weight loss is very important, but we need to maintain that integrity of the skin. So, you know, we do treatments, collagen stimulation treatments while people are losing weight. Basically, whether it's Gilane, whether it's Alanze, or any of the other collagen stimulating, basically to make sure we're improving that tissue laxity. So when they start losing weight, the skin can shrink with it. And I'm very, very careful about going slow, not fast, because the slower you go, the less inflammatory burden you're going to have on your skin. And we want our skin to be metabolically healthy. So Gilane is fantastic for that. We have Blair here from Gilane because it's basically prepping the skin. So when we get to kind of your end goal of actually looking at what's happened to volume, we can then actually inject, you know, properly with skin that is going to actually be metabolically healthy, but also strategically placed. So we're not going to, I don't tend to do volume at the get-go because we don't know, you know, what's going to be needed. But at the end, we're injecting into skin that is actually prepped and primed.
And I suppose one thing that I haven't asked you, which I should, is this skin issue inevitable? Is skin laxity a 100% certified? This is going to happen if you lose weight and you lose it fast.
If you lose it fast and you're not doing anything about it, I'd say yes. So we need to be making sure these patients are, you know, are taking, you know, supplements to make sure, because when people are not eating, they're going to get deficient in, you know, they become type B malnourished, which is basically they're not getting the calories in, so they're not getting the nutrients. And then that's going to cause problems because we need things like magnesium, zinc for all our cellular processes. So it's very important that, you know, we're doing this from the get-go.
And there's sort of a profile of a lot of the people who are seeking these drugs are younger, potentially. And so what could potentially be the long-term effects of having that malnourishment? I suppose that would would be whatever the age. But I mean, I'm guessing if we're sort of looking into the future.
Well, I mean, yeah. So if people are losing, they're losing a lot of weight, or they already have a healthy BMI and they're pushing their BMI lower, that's not healthy, obviously, for bone. It's not healthy for muscle. And a lot of these patients, when they're going into these prescriptions, they're not being told about all these, potential side effects of hair loss, muscle wasting, all these things, which are so important when we're in that initial consultation and going forward.
Yeah. There's so much to consider. Right, we're on
We could talk all night.
We really could, but I'm mindful that we want to get to our next destination because we are now in the sort of post-weight loss care phase in the very safe hands. Dr. Michael.
Well, the only comment I have to say is that less is more. Okay, we use, but when you use something, you end up abusing it. Okay, so we need to be careful. And nowadays, I think that we need the experts. Okay, and we need to know what the end point will be. In any journey, you need to have a plan. Okay, so we call in plastic surgery, okay, with Sandeep, that fat is the liquid gold, okay? It's the present and it's the future of plastic reconstructive and aesthetic surgery, okay? Fat is the answer to everything. So there's no point of wasting our fat so quickly with drugs, okay? And we see patients at the private clinic and we always say that safety comes first. And I say that because everything started 10 years ago when we had patients that were not suitable for having a procedure because the BMI, the body mass index, was a little bit on the high side, okay, on the higher end. That means that if you had a BMI above 30, okay, you could not have cosmetic surgery in the private sector. So it was so hard for these patients to become suitable, okay, that we were in need to find something. Now we have that something, and we don't only optimize the patients, but we take it, to the extreme end, which is we see the melting candle effect of the body, sadly. And this is a proper, an official term. Okay, so you see the patients that they are so happy that they've lost the weight, they are winners, but they wake up one day and they say, wow, and now what will I do with this? And they see the breast, the chest, men and women. Okay, so this is why they need to know that they need to see the specialists, the experts. They need to have someone to go to, okay? And the private clinic, I think it offers a multidisciplinary approach. So we start from the nutritionist, we go on with the drugs or the right products. Then if they need to just contour the body, because it's not all about being slim, it's all about looking great. Okay, so this is the point that many patients miss on their journey to lose weight. Okay, because it's nice to have a V-shaped body if you are a male patient, or an hourglass body, and then you realize that something is wrong with your curves and all that stuff, and it's irreversible. Okay, because we cannot work miracles. So at the private clinic, we see patients that they've lost the skin tone, the elasticity of the skin, patients that they have stubborn fat, because any drug will not remove the fat from certain areas. If you have a double chin, GLP-1 will not remove the double chin. If you have big hips, you will always have big hips, but you will shrink and you will be just in a different size, but your body, your anatomy will stay the same. It's your identity. So this drug cannot change your identity, okay? And then the plastic surgeon can only work with what you have, okay? So as a result, the patients, they need to come in when it's the right time. And sometimes if it's too late, then we might need to go something more aggressive or something more invasive. And then we come to Sandeep and we just do body lifts or breast lifts, up lifts, and the surgical options. But even having the procedure per se doesn't mean much, because yes, I'm going to contour the body by using different technologies. Sandeep will do his job, but then you need to realize that maintenance is a key point. So At the private clinic, it's a holistic approach because we have non-invasive treatments for skin tightening. Okay, so if it's just a small area, and you don't need the plastic surgeon to offering the procedure. We have semi-invasive procedures like Renuvion J plasma and all the radio frequency devices that it's proven that they help a lot, up to 50 to 60% to offer a correction of the elasticity of the skin. And then we have endovaser technique in order to remove the fat. And then we have the surgical approach that improves up to 90%. And the clear message needs to be that you cannot get the skin you had when you were a teenager. It's impossible. Okay.
Yeah. I mean, throughout all of that, I'm thinking a huge part of your job must be managing expectations.
It's all about
Try-
educating the patient. This is the magic word. The patient walks through your door and they are bombarded with a ton of information. They think they know everything, but it's all about Instagram, Google, ChatGPT, AI. But you need to see the expert, and you know who is an expert? An expert is someone who has dealt with many similar problems and has dealt with every complication and knows how to deal with a complication. The expert is not someone who has to tell you something, has to give you an answer. No, the expert is someone who has done everything wrong, but in the right way. If that makes sense. Okay, so this is the most important thing. And the patients, they're not left alone. They, they have the food package.
Now, we keep talking about GLP-1. I keep saying GLP-1, but we're really talking here about rapid weight loss. And I'm curious if the patient profile or the patient demand has changed in this new era where when weight loss happens, it probably is happening. I mean, you guys can also chime in here. Is weight loss generally these sort of significant weight losses, are they happening faster than perhaps ever before, which is why we're seeing this change in demand?
Yes, it does. And this is why we see so many amazing results on the scale, but so frustrated people. Okay. And I always tell my patients that liposuction, medication, cosmetic surgery, even all these body lifting procedures, they are not a magic eraser of poor lifestyle. So if your lifestyle is poor, if you go and eat junk food every day, if you never exercise, if you're not healthy, nothing will work. And this is where complications start. Someone who is a smoker, okay, might think, oh, I'm healthy. No, you're not healthy. And if you have a body lift, you have a ton of complications. And they don't get it. They think that if I'm slim, I won't get any complications. I get away, And this is the quick fix mentality. And people need to see results yesterday, not today, not tomorrow. If possible, yesterday. And this is why they abuse the drug. They have no patience. And this is, it's the most important thing. We see it every day. And then it's not about referring the patient to someone else. And they will do that. They will ask for a second opinion and a third opinion until they hear what they want to know. But we only tell them the truth because we are transparent. And, all of us, we're on the same page. I don't have to discuss my patient with Sandeep if I think that someone is not suitable. Sandeep will say the same. He's not suitable, period. So
Yeah. Now, we could do a whole conversation about what I'm about to ask you, perhaps for another panel discussion, but I didn't want to leave tonight without asking you about lipedema. The reason being that I think there are going to be several buzzwords in 2026 that we're probably going to be writing about a lot. One of them is GLP-1s. It's going to be continued. Fiber is another one, and I think lipedema is going to enter the conversation, enter the chat, as the kids say. We had a long conversation about this week. And I think it would just be really helpful to talk about this because obviously as part of this holistic treatment and protocol, lipedema is also something that someone can hugely benefit from the private clinic group's input.
thanks for bringing this up. And I just want to say very briefly, because it's a big topic, okay? And we could do many events talking about this, that lipedema is a disease. It's recognized by the NHS in the last 2 years, okay? Sadly, no treatment is offered at the moment within the NHS, just support, okay? So symptomatic support, okay? And it's the disease that the patients, especially female patients, okay, they will get abnormal fat deposition in certain areas, mainly the thighs, the calves, and the upper arms. And these patients, we call them the non-responders. They're not sensitive to the GLP-1 drugs, or at the beginning, because the body is accumulating fat for no reason. These patients, they go through a nightmare because the GP, which is the first doctor you see, 2 years ago, they knew nothing about it. And, it's very easy to say, oh, you eat too much. No, it's not like that. This is not the reason, because if you see, these patients feel like they have two different bodies. The upper body, which is very slim and toned, and the lower body, which is completely different. Okay? So at the private clinic, we have something that we call the private clinic pathway, the protocol, and has 5 steps. First step is the clinical diagnosis. The second step is the optimization with a nutritionist and drugs or VIX scrutinizing the patient for any other disease, okay, and hormonal imbalances. Then the radical harvesting of the fat, the stubborn fat, the recovery, which is the most important bit to recover in the right way. And last but not least, the maintenance. Okay, so we know what it is, we know how to deal with it. It's a long journey, but I think that it changes lives. Okay.
You said the radical harvesting of the fat. This is liposuction.
Yes, correct. And we use the Vaser devices, which is the Vaser, it's the acronym of the ultrasonic power. That means we emulsify the fat. So the experience is a lot better. The downtime is reduced. We have the radio frequency devices to tighten the skin up. And if needed, I will repeat, or when needed, we have experts like Professor Sandy to take the extra step and to, some other procedures to make the body look more balanced.
And it is a disease. It's been recognized as a disease. There are 4 stages of lipedema, but it might present in being pear-shaped, which I think, going back to your point about maybe there are things that you feel like you're at a disadvantage. It's not just a body shape anymore. There is actually potentially a solution.
Where I come from, because I'm Greek, okay, Mediterranean. So in the Mediterranean, the incidence, so how frequently you see patients suffer from this disease is 2 out of 10 women. Okay, and you see that every female patient will have a mother or a grandmother suffering from lipedema, or something that we call the pre-lipidematous condition. For no reason, the buttock area will be shaped in a different way, or they will just have fuller cups. And this is a sign that is simply neglected by every doctor or surgeon. And usually these patients complain about one thing: heaviness during the day, easily bruising, and they are referred to the vascular surgeon because they think there is a vascular disease, which is completely the opposite. It's the accumulation of fat that increases the tension inside the leg, and this is why the veins burst, and this is why by the end of the day you get this swelling and heaviness. So the only option is to debulk the leg and get the benefits of enjoying life again with smaller legs and less tension.
And this is the first time we can really act on it, diagnose it.
Effectively.
Yeah, effectively. Which is why I think it's going to be such a huge
Yes.
buzzword this year. Right, we're going to begin our descent. Sandy, let's move on to your expertise. So this is post weight loss as well, and this is surgical care, surgical intervention at times. So what are you seeing in light of this entire conversation? How is your approach relevant in this protocol?
Yeah, so before GLP-1, patients who lost a significant amount of weight would have had surgery, such as gastric bypass, gastric band. The introduction of GLP-1 has not eliminated that, but it's like what everyone has said here today. We've moved, we've not started to what we're running, we're sprinting. And that will only lead to further issues for patients. And everyone said this today, it is not like the GLP-1 kind of influx, it's almost like one size fits all, and it's not. And every patient that's lost weight is bespoke. They have a different journey. The reason for losing the weight, whether it's epigenetics, whether it's a social issue, or they want to improve their way of life. And that has to be taken into account of how they are and what their reason was to get it before we even start discussing the surgical element. And when they've lost the weight, it's interesting, isn't it? They say, and they come in and they go, do you know, I actually felt a bit more confident when I had that extra weight. And like Michael said, I'm really happy that I've lost this weight. But when I look at the outcome, I'm just really not confident. I'm not happy. I don't feel like I can enjoy life, as you said. And so that then comes to contouring, and it's about being in proportion to their frame. So every weight loss surgical, post-weight loss surgical intervention is different. And we will take into account everything that Layla, Vix, and Michael have said in their assessment of skin. And a key thing that Tori said is that skin takes time to settle down. And so when people lose that weight and they lose it very fast, that skin laxity, they come in and they go, right, I think I should have my tummy tuck now. And my weight's been stable for 4 weeks. And we've got to guide them and say, do you know, skin, as much as that, like Mike said, the fat will change quickly, you can take it away quickly. The skin really does take time. So we've got to have a maintenance of stable weight for a good 6 to 12 months. And we hold hands and, you take them through that. And I always say to my patients, you know what, we're going to work as a team, right? So if you say something that I think is unreasonable, I should be allowed to say it. And if you think I'm saying something unreasonable, you should speak up. All right. And then, and we do work together, because the first time they come into a consultation and the way they walk in, and you will have seen this, they're a bit down, a bit out. And then after treatment, they're coming in for their follow-up at 6 or 12 weeks. They bounce in the room. You see like rays of sunshine. And it's for us, I think that's a marker of, oh, this is great. This is actually why we do this. And one key thing I was saying to Layla earlier on, is that nutritional journey is sometimes forgotten by patients. And I think at the private clinic, we're probably the only clinic, or one of very few, that will provide that global approach to this process, because it is a journey and it is not a conveyor belt where you say, right, today I'm going to do a tummy tuck, and then I'm going to do this and I'm going to do that. No, everyone is individual, everyone is different. And so here we really kind of take into account the patient as a whole person, and whether it's before the operation and after the operation, and that follow-up for 6, 12 months or longer if they need it.
And when we spoke in the week, we were talking about body contouring. And I said, it's so funny to me because body contouring is what you do. And it sounds a little bit like a support garment, but it is a little bit more involved than that. It seems like something you'll come in and you'll go into a machine, you'll spin around and you'll come out. It's not like that.
It's not. And this thing, when you look at before and afters, and you'll see them on various platforms, and you say, this was me before and this was me after, and look at the difference and look how happy I am. But it's all of the bit in between. And the surgical approach can be fairly straightforward, but it can actually be quite complex in terms of what we want to achieve for a patient. And sometimes you'll see someone, for example, just a few weeks ago, I operated on someone who was 70 kilos, but before that was 140 kilos.
Wow.
So you think, okay, so when you see them in clinic beforehand, so we need a plan of what we're going to do and how we're going to achieve those goals for that patient. What is it that you want to achieve? Yeah, we want to contour, but where do you want to, where do you see yourself in the next 2 years, and then 5 years and 10 years? And that conversation then leads on to what everyone else was saying about maintenance afterwards. Because there's one thing about doing this. Yes, you've lost the weight. You get back to how you were before you put the weight on. What we don't want to do is go back there again. Because these operations you don't want to do again. You want to do them once and once only. With a GLP-1, yeah, you start, you don't want to keep going on it, but the risk of going back on it is less than having another massive procedure, because these are big operations. And it's not just the skin. It's, we're kind of made up of layers. We have skin, we have fat, we have a structure called fascia, which then attaches to muscles and certain prominences that provide structure. For example, Victoria is mentioning the gaunt face where things are kind of stretched out, and skin will lose elasticity to a point, and but underneath that, you need to hold that skin up. So not only are we contouring the skin, we're contouring the underlying deeper tissues too. So then you can, I'll say this word, it's more sculpted, more defined to your own frame. And that's the key thing, being in proportion to you. And that's, I'll go back to what I said at the start. It's not the same for everybody.
You touched on something there that I think we should perhaps all weigh in on, which is that the everything I keep hearing at the moment is microdosing, or as Michael very said to me this week, titration. But this idea that you can use GLP long term, I'd be really interested if you can just comment on that, because I think everyone in the room is probably hearing about it quite a lot and maybe even writing about it. So in terms of this holistic approach and long-term treatment, does that factor in?
It does. So I have a number of patients who will look to stop the GLP-1. So they've completed my weight loss journey. I'm maintaining my weight without the GLP-1. I feel well. I've done this for about a year. I'm now ready to contour. There are some patients who will say, I need to have a maintenance dose of GLP-1, and that's absolutely fine. But from a surgical point, and this is something that we're still trying to understand from a surgical perspective, we were saying to stop the GLP-1 2 weeks prior. I've now increased that to 4 weeks prior to having the surgery. And over the pond in the States, they say that most people have increased it to 3 weeks. Why is that? Well, we've noticed that there may be some issue with wound healing to a degree. It might be the fact that, you get a reduction in an inflammatory process, something that you actually need to allow you to heal. And then we restart it about 4 weeks after. But it's absolutely fine. If it's the GLP-1 that allows you to maintain that status quo, then that's fine. In addition to your nutrition and your exercise. So there has to be, it can be used, I guess, as a lifestyle change. But not, like Michael said, not to an excess.
Yes, and there's also one very important thing, and I will add to that, that you have a procedure and your body has memory. So after 3 hours, you wake up and your body is in shock, literally. So you need to get your body used to your new body, because abruptly we remove skin, fat, fascia, whatever. So the body needs time to adapt. So your body will fight back. So your body will swell up and will try to retain water, because believes that you have the same amount of skin or fat. So this water retention needs to be eliminated. This is why we introduce the lymphatic massages. This is why I think low dose, or this is why we give medication, to take the inflammation down, because the patients need to recover. So part of the recovery is when you're on a drug, you need to recover after using the drug. So it's the same thing. So everything is interconnected.
Well, wonderful. Well, we have landed. We are on the runway. We're on the tarmac. Thank you so much, everybody. Love you to join me in a round of applause for our attended experts. Thank you so much. And thank you so much for coming. And please don't forget that there are some incredible consultations and experiences downstairs in the clinic. If you come out that door and turn right, you will be able to find some. I think Matt Pelth is here.
Yeah, Matt Pelth is here. My team's here from Bournemouth. And who else have we got here? We're around as well. So if
There's
anyone wants
also
to have a
some
chat with us,
refreshments
yeah,
that you've probably
absolutely.
seen. And also we have to mention that we have an author on the stage, whose book is at number 7 in dermatology on Amazon. So
Busting the code to aging.
Code to aging. I have my coffee, but you should probably all go on Amazon and get one too. I might get one just to support you, nudge you up those charts.
Thank you.
But thank you so much for joining us at the private clinic. It's been so wonderful to spend this evening with you.
And thank you, Emma. It was brilliant.
Thank you very nice to be here.